Hey guys, welcome back to another video. Thank you so much for watching and supporting. Welcome back to Empowered RN. If you're new here, I'm here to tell you that this channel is for you. Yes, it is for you. So press that like button and press that subscribe button for more content. So over here, we share information for any healthcare professional, especially my nurses, as I'm a registered nurse, practical nurses. We share content for also our healthcare professionals and any other professionals. We're expanding the basis based on the requests that you have been given. So we're going to share nursing opportunities all across the world, opportunities for everybody across the world, so that you can make yourselves and your families better. Now, in today's video, we're going to talk about some top 5 questions for my nurses and anybody else that's in a profession that's going to do an interview. Top 5 common nursing questions that you may be asked for your interview. So you do your NCLEX, you select your state, you select the hospital that you want to work, you have an interview that is coming up. You want to get that interview right because that's the place you want to go. How can you maximize your chances of getting this job placement? Stay tuned and listen for more. All right, so in the video, we're going to talk about some common questions that I have seen that has been asked over and over once you get ready for that job interview. Well, we know an interview, it's very big because you're getting ready to meet the facilitators of the institution that you have chosen to work with. You're going to meet, in your interview, some common faces that you're going to see after you leave that interview. If you are selected, you're going to meet your nurse managers, you're going to meet some directors, and sometimes they may ask some floor nurses just to come in and just sit around. Some days may be hectic and you may just see one person in an interview, such who is the nurse manager for the unit. Now, these are the individuals that will do the interviews for you and determine if you're the right fit or the perfect fit for their unit or their hospital systems. Now, before we go into the video, we're going to talk about some common and basic things that you need to know before you do an interview, which is basic. Some persons may know, others may not know, because for some of us, after we have graduated from university, we have gotten our first job, we haven't really looked for any other job, so it may be kind of new for us to get back into that group of doing an interview. So first thing that you need to do, if you have selected your placement and you got an interview, you need to review the institution that you're going to be interviewed by. Look at the vision and the mission of the institution. Just go on Google and read up any achievements that they may have recently, and just read about the institution to see about their accomplishments, vision, any initiatives or measures that they have implemented, and know about the facility. Read up on your unit also, find out what your unit is about and what they specialize in, especially if they had recent accomplishments. Reason being, you may be asked questions about this, and it should be good, and it shows that you're assertive when you're being asked a question and you can answer back and place back the mission, the vision, and speak about any achievements or measures that you have noted. Now, other basic things that you need to do before you go into an interview, you need to prep yourself. If you know that you're not so good in interview, have a family member or a friend to sit down with you and just place down some basic questions, such as the questions that I'm going to tell you about, and just ask somebody just to interview you and do a mock interview session with you, so that you can see where your weaknesses are, your strengths, and for them also to grade you in return to improve on yourself. The other thing that you need to do before you're going into these interviews is that you need to make sure you have 2 common things: confidence and assertiveness. Make sure that you are confident, even if you don't know what you're going to say, what you're going to do. Make sure that you're confident. Marcus Mosiah Garvey said that before you start the race of life, you must start with confidence. I don't remember all of it, but once you start the race with confidence, yes, you have already won that race. That's it. Next thing, be assertive. Be assertive and be quick, paying attention, maintain your eye contact, following the room, looking at each person when they speak and ask the question. So these are some common things that you will need when you're doing your interview. And please also remember to dress appropriately. Dress appropriately in terms of your top. Make sure that you have on something that is either formal, no sleeveless or anything, just to make sure that you're still maintaining your interview setting. Now, some common questions that you'll see, and I'm going to list 5. There can be more, but these are some common questions that you will normally be asked, and I've jotted them down. Who can tell me the first one? This common question is so common, I don't know if you guess it. First question is, tell me about yourself. Now, this may not be the order that they ask it in, But this is a common question that I've been seeing, and I was asked this question to tell me about yourself. So this is where the interviewer wants to get, or the employers want to get to know you, to see who you are, your accomplishments, your achievements, your years of experience in nursing, when you started and how you started. For me, it's basically like telling a story of how and when you started in nursing and where you are now. Now you just give that overview, and you also can put in your accomplishments, your achievements. You can drop in your families, everything, and just tell the person about yourself. Now, you're not going to give them the whole 9 yards. You're going to give them a summary that sums up you in like a 1 or 2 minute answer. The next question that you may be asked is, tell me about your strengths and your weakness. Now, people, everybody has strengths, everybody has weakness. Make sure you know your strengths, and please relate these strengths back to your profession that you are in, whether if you're a nurse. Some common strengths that you have is that you have the ability to work under pressure. You know how you utilize critical thinking very well. You're a team player. Your time management, you're good on documentation. Those are your strengths. If you go into an interview and they ask you what are your strengths and your weakness, please do not say you do not have a weakness. Everybody has a weakness, and if you should elaborate on your weakness, make sure you always show your interviewers that you are working on your weakness and you're taking the necessary steps to improve your weakness. Now, some persons may ask, like, as a nurse, what could be your weakness? One weakness I may use as an example is that you work well under pressure to the point sometimes you do not know how to ask for help. That could be a weakness, and then you show how you are working on your weakness. But over my period of time of growing in my profession, I learned that it pays a lot to ask for help, and if you do not ask for help, sometimes you may not get the job done. And if you ask someone and they're not willing to help you, you can follow the chains of commands by going to your charge nurse or unit manager for assistance. And that is how you answer that question in terms of my tips and my opinions and advices of how you answer questions such as, what are your strengths and what are your weaknesses? The next one will be number 3. A common question that they normally ask is scenario-based question. Scenario-based question that is linked to your unit. Say, for instance, if it's an emergency, what do you do in an emergency? They may give you like literal practical scenarios that you have to think on your feet about and how you would respond to this scenario. Now, in answering your scenario-based questions, always remember 2 things. Scenario-based questions, they are looking for how you manage a scenario and how you respond to the scenario. Within nursing, always remember that once it's scenario-based, you remember your critical thinking and you always follow protocols and policies. And guess what? Follow your chain of command and you'll never go wrong. So if you're having an emergency and I'm trying to think of an emergency that you could think of in terms like you're having something on the unit, always follow your policy manual, policies, and always follow your chain of command in how you respond. All right, so those are how you answer scenario-based questions. Some scenario-based questions would be like, if you're having like code blue on the unit, how do you respond to that? Other scenario-based questions could be that you have a patient who may have a low blood sugar. How do you proceed with that, and how do you follow protocols with regards to that? Always remember that you maintain and you follow your protocols, your policies, and also you follow the chain of command. And remember, in your chain of command looks to who you report to. So you always have a charge nurse, your unit manager, then a unit manager, your director, and that's how the chain of command moves. All right, next question, and that will be number 4. Other questions that you may be asked can be scenario-based too, is dealing with difficult patients or difficult co-workers. How do you deal with that? Some of those are some questions that you may be asked. How do you respond to this question? Be truthful, be honest. How do you deal with difficult patients, difficult co-workers? What do you do? Always remember, follow your chain of command, and before you answer these questions, make sure you actually do something to try and dissolve the situation, and also include your policies and your chain of command. Now, if you have had experience with dealing with difficult patients or difficult co-workers, you can talk about it and how well you handle the situation. Number 5, if you're in the interview and you are asked, do you have any questions? Always ask a question. Never do an interview without asking a question. Even if you do not know nothing to ask about, make up a question, please. The night before your interview, think of something that you can ask if you have a question. So common questions you can ask about staffing, you can ask about scheduling, you can ask about common conditions that are going to be seen on your unit, you can ask about common skills that you'll accomplish on your unit, ask about what is a regular day on your unit like. Those are some questions that you can ask. Please do not go in on the people them interview and ask them about family, how well they care and all of those stuff. No, your interview is all about your job and you being on the unit. Family, children, off limits unless they ask you about it. You deal with that with your company and your recruiter. The next thing in your interview, guys, and I just gave you 5 common questions that they're going to ask you. And if you're asked a question about how do you see yourself in a year or 2 or 6 months, give an overview of where do you see yourself in terms of growth on the unit or the facility or the hospital. Please, this is my opinion. If you have questions and you're going to answer this question, talk about your growth on the unit, where you see yourself growing in 6 months and how you're going to proceed. However, if you have plans to go back to school and say, for instance, you want to go to school and you say you want to complete your PhD, silence. Silencio. Take it from me. Silencio. Anything regards to growth on your growth and your success and movement over the years, keep it to your unit specifically. Any other thing that requires you to be out of the facility or out of that unit, silencio. Let's read between the lines. You're looking for a job to go to that unit. That is an interviewer or an employee looking to keep you on the unit. They don't want to lose you. So the interviewer literally wants to see how well you're going to grow on the unit and where do you see yourself on the unit. The reason being I say silencio, keep it to yourself. You never know what can happen. It can be positive, it can be good. But if I am an interviewer and I'm looking for somebody and they say that they have big plans to do something like that, kudos with you with that, and I'm happy for you. But that shows to me that you're not going to be here for long and you don't want that. You want somebody that you know that's going to be staying here and helping you on your unit. And that is why I say silencio. Now you can take my advice or you can utilize it or not. What are your thoughts? What are your comments? Do you agree with some of these 5 questions that I have listed that are some common questions that you'll be asked if you're considering to take up that job and if you're an international nurse that is looking to relocate? Do you think these are some common basic questions that they normally ask? Any other questions that I have left out and you wanted to hear, drop them in the comment section below and let us have a discussion. How well was your interview? Did you ace your interview? How was it? Did you leave that interview feeling confident, knowing that you did well and you did your best? Thank you guys so much for watching this video. If you like the content that we are producing, I said we, but it's only one person. Sorry. If you like the content that I am producing, please press that like button, press that subscribe button for more content. Drop in the comment section some videos that you'd like me to talk about. I do watch your comments and I do listen and make the necessary adjustments as possible. Remember to press that like button, remember to press that subscribe button, and come back for more. Thank you so much. See you in the next video.